Hello, I'll be doing my patient this week on a 41-year-old female admitted to our hospital with a diagnosis of opiate dependence and withdrawal. She's admitted on the 22nd in the afternoon. Uh, Her drug of choice is heroin slash fentanyl, and she snorts about 1 gram per day. Her last use was on the 22nd around 11 a.m. Prior to about 7 months ago, she was clean for around 2 years. She relapsed related to multiple deaths in her family and with her friends related to both drug overdoses and some natural causes. Um, she reports awareness that she turned to drugs as a bad coping instead of going to counseling. However, with her environment of being around drugs and her learned coping throughout the years of abuse, this is what she turned to. She currently reports her mood as sad, related to her facing reality and going through detox, saying that she's dealing with depression and anxiety right now as well. Uh, as far as her appetite, she's been eating about half of her food. She also reports that she slept good last night. She is taking melatonin to help for sleep. She is also taking gabapentin and hydroxyzine. She reports that the hydroxyzine is helpful for her anxiety. She also has a history of drug abuse with uh, starting with tobacco, about half a pack per day. Alcohol, she says she drinks occasionally. THC, she smokes about 1 joint per month, she said. Cocaine was the only positive that came back on her urine tox screen. She said that she does cocaine about 1 to 2 times per week. Fentanyl and heroin, she reports 1 gram per day, and most likely it was fentanyl that she was doing prior to coming in, since cocaine was the only drug that showed up on her tox screen. She also reports taking Oxycontin and Percocet years ago. She has in the past tried Suboxone. It was helpful for her. She has tried methadone in the past too. Um, Treatment includes at the Zeph Center, where she had methadone treatment, a Renewed Mind she was at twice, Joshua Treatment Center she got treatment at as well, and then most recently came to our hospital. She has been through detox. This is her third time now. She has never needed Narcan. However, she has had to Narcan her boyfriend about 7 times, she reports. Um, Currently, she is living with her mother, who has the beginning stages of dementia, and she has her boyfriend who lives in the house with her. She's not working currently. Her boyfriend is providing her with drugs. Going on to evidence for a personality disorder, I would say there's none. Medical, the main issue that we are concerned with is her withdrawal. Um, her access for problems with primary support groups, including her mother in the house that she is taken care of. Her mother provides no support for her, and her social environment is troubling for her to remain sober, related to her boyfriend supplying her with drugs. I give her a 50 for Axis 5, serious symptoms and impairment in social and occupational functioning. Um, and some of the things that went into development of this drug abuse for her is growing up. She has always been around drugs, her family, friends. That's what she learned how to cope with life. Going forward, she does have the insight to know that she wants help and needs help and wants referred to a psychiatrist for outpatient treatment to help avoid coping with drugs in the future. So at least this is a start for her. And she has done it in the past. She was sober for 2 years, so it's just trying to help prevent that relapse. And then also, Um, she has a diagnosis of major depressive disorder and anxiety. So I am going to be following up with her further when she's not currently going through withdrawal right now. Her attention and memory are affected pretty significantly currently, so we're letting her rest. I'm going to follow up with finding a time where she was hopefully sober on drugs and utilizing prescription medication to treat either major depressive disorder and or anxiety, and see what was helpful for her, what was not helpful, try to get a baseline, and then go from there with possibly starting a new medication to treat those for her. And that is my report. Thank you.